For coming here tonight. I was thinking, back before COVID hit, I was doing quite a few patient appreciation days and talks and presentations, and then COVID hit, and it's been 5 years since I've done something like this. So it feels really good. We did a talk at, come on in, Tony. Everyone, this is Tony Nab.
Hi, Tony.
It's like cheers. So anyway, we did this at lunch, and then we're doing it again. So everyone, this is Chelsea Nab. Chelsea is a nurse practitioner. She is my sister-in-law, and she is just within the last month started here as well. She's working at building her own practice here. She does IVs. I'll let her tell about herself. But tonight we're going to really talk about these GLPs and GLP alternatives, because there's a lot of talk out there on GLPs. So I'm going to let Chelsea start.
Yes.
And then we will be back and forth. And this is very interactive, so please feel free to ask questions throughout. Don't feel like you have to wait till the very end. We want that interaction with you, so go for it.
Yeah, hello. And let's give it up for 32 years. I know that seems like all you guys know Georgia, so you know how great she is in caring and giving. So 32 years is pretty impressive.
Thanks.
So I'm very glad to be working with her. So GLP-1s, because everybody kind of at least heard a little bit, knows a little bit about them. Yeah, a little bit, yeah, okay. So, so what are GLP-1s? GLP-1s are actually a naturally occurring peptide. It's made in our gut, and it helps with appetite, hunger, blood sugar regulation. It works on insulin production. So insulin will take the glucose from the blood and deliver it to cells to be used for energy. So it's really important getting that, the glucose to where it needs to go. It kind of, you can think of it as the traffic light of your digestive system. So it tells you when you're hungry, tells you when you're full. And it works by delaying gastric emptying. So food will stay in your stomach longer, keeping you fuller longer, thus eating less. And again, with the insulin, it helps with the production and also helps the cells accept the insulin. So instead of being insulin resistant, being more sensitive to the insulin. And one of the things that I think really sets it apart from other weight loss therapies is that it triggers the brain with satiety. So it tells you you're satisfied, tells you you're done eating. Because, a lot of people, we don't just eat for hunger. We eat socially and emotionally and out of boredom. So it really just kind of helps quiet that and only eat when you actually need to eat. So it has been really great for weight loss. It was originally a medication for type 2 diabetes to help with glucose control. And they found over time that it was really good for weight reduction as well. So it's also good for cardiovascular and kidney protection. More and more studies are coming out about all the other good things that it's for. So some side effects that people experience, the common ones are nausea and indigestion. Typically over time those will subside and go away. Usually people tend to experience it either the day they take their injection or when we're increasing their dose. And then other barriers to it, insurance. There are a couple that are approved for weight loss, but insurance makes it very difficult to get it covered. They have lots of hoops to jump through, and it's very, very expensive otherwise. So, and then also, it is possible to regain the weight you lose if you stop, especially suddenly, and don't taper off as we're supposed to. So we're really trying to instill healthy lifestyle habits along with the GLP-1, mindful eating, moving, being active, to really make those lasting results. And it is not a magic bullet, so you can't plan to lose all your weight in the first month or two. It's a gradual process, usually about 1 to 2 pounds a week, focusing on protein intake, hydration, and again, just that mindful eating, and picking up good habits, eating whole foods. And there are several GLP-1s out there. These are the 3 that have been approved for weight loss. The semaglutide was kind of the first generation. The tirzepatide is now out. And then the last one, I don't even mess with because it's a daily injection and people typically would rather inject once a week versus once a day. And then I like to highlight tirzepatide because it works a little bit different. It's still a GLP-1, but it's also a GIP. So it gives a little extra oomph on the insulin production and insulin sensitivity. So it's better for our clients that need to lose a larger amount of weight. Works a little faster, a little better. So these are just some numbers. That first one is a 72-week study. And people on tirzepatide lost about 20% of their body weight versus semaglutide, where it was 13.7. And then in a 40-week trial measuring A1C, the tirzepatide reduced it by 2.3% versus a semaglutide, which was 1.2. So you can see the semaglutide's still very effective. Tirzepatide's just got a little more oomph to it. So people who can benefit, obviously diabetics, because it's a diabetic medication, but anybody with obesity, anybody who needs to lose that extra weight, anybody who has that relationship with food that it's just calling to them all the time, it can really help change that relationship as well. And again, people who are committed to change, it's you've still got to put the work in, you've still got to be mindful, you've still got to move. And this is a case study. This is a mutual patient of ours. Do you want to
Sure.
talk a little bit?
Let me jump in. So this is a patient, been with me for a long time, 55-year-old male. And you can see all the symptoms that he has there. And we tried a number of things. We tried the berberine, we tried different diets, and something would work short term, but the weight would always come right back, and sometimes even more. And so we found that kind of the biggest challenge with this patient was the food talk that he's dealt with. So in March 13th, I did labs, and this is what came back. And so you can see that glucose, his fasting glucose is sitting elevated, 120, that's pretty high. Average should be between 80 and 90. And then we come down here, and these are his liver enzymes. So we've got a fatty liver and liver inflammation. And then we come down a little bit more, and we can see these lipids are very disrupted. So total cholesterol is elevated. Big one is this triglycerides. Triglycerides tell us how your body manages carbohydrates and sugars. So we want those less than 100, and as those go up, then the body is not managing sugars very well. And it's one of the first places we see blood sugar disruption happen. And those HDLs are pretty low. So cardiovascular risk here is pretty high. If we come over here, we can look at those insulin markers. So we hear about insulin resistance, and this is insulin resistant. So every time this patient eats a carb or a sugar, the pancreas makes insulin, but that insulin is taking the sugar and it's knocking on the cell to try and get it out of the blood, but the cell isn't responding. So the pancreas responds by making more, God bless you, and more insulin to try and pull that sugar out of the blood. So this is full-on insulin resistance. C-peptide lasts longer in the blood, so it's even a longer picture of what's happening to the insulin resistance issue. He's got a little bit of cardiovascular inflammation, and then his A1C. Now your A1C is your average blood sugar over 90 days. It's really our long-term marker of blood sugars. So we want that A1C between 4.8 and 5.6. 5.7 to 6.3 is pre-diabetes, 6.4 is diabetes. So this patient's sitting at 6.1, so we're pre-diabetic. Now, the easy way to think about this is that your blood should be like water flowing through. But when we have pre-diabetes into diabetes, your blood becomes more like Kool-Aid. So it becomes sticky. And so that sticky blood is sticking to the arterial wall, and that creates inflammation. The body's natural response to inflammation is to raise cholesterol. It's the body's defense that we've got a fire going on and we've got to put this fire out. So then now we've got sticky blood, and now we've got some plaquing and inflammation on the arteries. So what does the heart have to do? It's got to work harder, right? What's blood pressure do? Blood pressure goes up. I am not knocking the medical profession. I'm just saying that they're doing standard of care, but their standard of care says the first thing they see is typically is either your lipids are up or your blood pressure's up. So they put you on a statin and they put you on a blood pressure medication, and they ignore the underlying issue, which is the blood sugar. When in reality, if we actually address the blood sugar issue before it gets to that point, then we don't have to end up on those medications, because we want to address the underlying issue, which is the pre-diabetes. So 4 months on working with Chelsea on a GLP semaglutide. So we redid the labs. Look at his fasting glucose. It's at 88. It's right where I want it to be, between 80 and 90. His liver enzymes, they're now back into normal. His lipids are much, much better. Still some inflammation, but this is only 4 months. His insulin and C-peptide are now well in range, almost where I want them to be. And look at that A1C, 5.4. I mean, this is pretty dramatic, the change in just 4 months. This patient was very motivated, very much focused on protein like we asked him to do, really followed things well, and made a pretty dramatic difference. Within that time frame, that patient was down 30, 35 pounds, now down just over 40 pounds. But I want to stress, this isn't about weight. At least in my perspective, and the reason I support the GLPs is because it's not about losing all this weight. It is about healthy hormones. Because if your hormones are healthy and your body's metabolically stable, the weight will take care of itself. It will just come off. So we can't focus on what that weight number is, because it's really not that important. What's really important is how healthy these hormones are, especially insulin and C-peptide. So that's why I think it's important, because if I have to decide and help a patient think, do I want this patient on a statin and a blood pressure medication and then metformin and then going down that pathway, and statins promote type 2 diabetes, do I want that? Or do I want a patient on a peptide that our body naturally makes, but for some reason this patient's body is not making it at this time? I'd rather a patient be on a peptide and avoid all this stuff, and then work on that lifestyle. And the other big thing I think about the peptide again is that it really does stop that food talk that a lot of people are dealing with, because there's food everywhere and it's not great food. So when we can stop that food talk and their focus goes off of food onto other things, that also makes a big win for the patient. So this is a huge success. Very excited for this patient. I think we both are.
Did you say that he was able to come off blood pressure medicine?
Oh, yeah, that's true. He was on blood pressure medication, completely off of it now. So, yeah, that's right. Thank you.
Okay, so some components to work along with the GLP-1s. I keep harping on it: nutrition, being mindful, eating protein, eating your whole foods. The strength workout is really important, because they say there's a 3-to-1 loss. For every 3 pounds of fat you lose, you'll probably lose a pound of muscle. So really important to protect those muscles, keep them moving, keep them active. And then sleep and stress affects everything, right? Our mental state, which can then make us eat more, but it also really spikes our blood sugar as well. And then there's some great supplements that Georgia's going to share with us. And yeah, then I would just say have realistic goals. Like I said, don't plan to lose all your weight in the first 2 months. It should be gradual, it should be slow, it should be healthy. And then, yeah, focus on the energy, longevity. That's your food and moving again.
So are there alternatives? Yeah, there's alternatives. I'm going to just talk about 3. One of them is called Akkermansia. And Akkermansia is actually a good bacteria within the gut. So I oftentimes will do a stool analysis on my patients. And because I want to see what's happening here in the gut. Do we have good guys? Do we have bad guys? Do we need to kill off some bad guys? And do we have Akkermansia? Because what we know is Akkermansia makes up somewhere between 1% and 5% of the gut flora. And Akkermansia is very important for your metabolism. I think of him as Pac-Man. So if you can picture Pac-Man, what Akkermansia does is he's in there and he's eating that mucus barrier so that your tube in here can remake healthy barrier. So that's one thing that it is. But it's also very important for your metabolism. And what they've seen in studies is that patients that don't have Akkermansia or have very low levels of Akkermansia, then the obesity is much higher in those patients. So we know Akkermansia is very important for a healthy weight. And Akkermansia is a bacteria that helps your body make this peptide, this GLP peptide. So we can supplement with it. And there's only one company that has a viable form of Akkermansia that I'm aware of, and that's Pendulum. And Pendulum has a few different lines. One of them we carry upstairs. It is specifically for the GLPs. It's not just the Akkermansia, there's another strain in there that we use with the GLP. So one of the things we hear about when you're taking a GLP is, once you go off of it, you're going to regain. Well, you don't have to. If you do it right, and we support the Akkermansia, then the goal would be to get off of it and maintain a healthy lifestyle long term, right? So that would be our goal. So this is one of the key things that we want to use with that GLP to help make sure we've got that good healthy bacteria. Now, Akkermansia too, he feeds off of things that are red. So we want to be eating foods that are red, like I have apples back there, red apples, strawberries, cranberries, red quinoa. Those are anything with red is rich in polyphenols. That is what the Akkermansia feeds off of. So we want to also make sure we're eating some foods that are red so we can help him to stay in there long term. So Akkermansia is definitely one of the key supplements that can help. Does it have to be with the GLP? No. I have another. They have different levels. When I do a stool and someone has none, sometimes I'll put them on a different one that's a 500 level. So all we're trying to do is re-inoculate that patient with the Akkermansia and then wean them off of that. So this is some of this is on your table. There's some handouts here that's on the tables that tell you a little bit more about. There's quite a bit of research behind Akkermansia, so that's on the table there. And this is a little bit more just telling how this Akkermansia specifically will stimulate this peptide, this GLP peptide. So another one that's pretty new to me is called Calocurb. And Calocurb came out of New Zealand, and there's quite a bit of research coming out on this product as well. It is bitter hops. And that's pretty much what it is. And what we know and what I've talked to patients for years about is how important bitters are. Because bitters help your stomach to make good acid. It helps with digestion, but it also has an impact on satiety. And so we have bitter receptors not just on the tongue, but we have them all over the body. And those bitter receptors are sending good messages to your brain. So we need these bitters to help support our healthy digestion. You can get bitters from foods. Black coffee is a fantastic bitter. We can do arugula, broccoli, Brussels sprouts, ginger, dark chocolate. I've got dark chocolate back there. That is a bitter that you can eat that helps to support. But beyond that, CaloCurb is a specific supplement that works similar. They've shown that it helps to increase, again, those GLPs. The challenge, I think, with this is, instead of 1 shot a week, you're taking this 1 hour before you eat. So those bitters get in there and help to reduce your satiety. So it seems to be effective. I don't have enough experience on it to be able to say, yeah, this works great. But the research is definitely behind it. So it's an alternative as well. And then the third one you may have heard of is berberine. And berberine has some fantastic research behind it. It's been studied with metformin. Metformin is a medication that is very commonly used with prediabetes and diabetes. And it's been shown to be as effective as metformin without all the side effects of metformin. Berberine it is also a bitter, so it helps with satiety, but it also helps with insulin, and it helps that insulin to get into the cell, those cells to be more responsive to insulin. So that's why it works. With berberine, you take it, the research all shows 500 milligrams 3 times a day. So basically you're taking it 3 times a day, once per meal. So it works, but I will tell you, that is one of the products that I used on that patient that you saw that for him it didn't work. So it works for some, right? It's like anything, it works for some people. For some people it just doesn't work very well. But it's an option, right? And that's, you know, it's important to know your options and what's really right for you.
So are those natural?
Yes, these are all natural. Akkermansia is just it's a probiotic, bitter hops, all natural. Berberine is an herb.
Okay.
Yeah. So we have to, one of the key things here is we have to have a focus on proteins. No matter, you know, what you're doing, your focus needs to be on proteins. You want to minimize those simple carbs and processed foods. And one of the common symptoms that Chelsea talked about was nausea. I think one of the reasons that there's a lot of nausea with the GLPs is because patients are having some hypoglycemic responses to the GLP. What that means is most of these patients have too much blood sugar. What the GLP can do is drop their blood sugar, so their blood sugars go a little bit too low. Very common symptom of hypoglycemia is nausea, especially if you wake up in the morning and you just don't feel good, things are queasy for 2 or 3 hours and you don't want to eat anything until 10, 11 o'clock. That's a sign of hypoglycemia. So we can control that nausea, I think, by really making sure that lifestyle is supporting a good diet. So high protein can help really alleviate a lot of the nausea that we're seeing. So another concern is rapid weight loss can cause a gallbladder dump and can cause a gallbladder attack. And so we want to be careful with that as well. I see this more with women. You know what the most common surgery is in women? Gallbladder. Having the gallbladder removed, typically in the 40s. So we have a couple of things going on here. With a woman in her 40s, she's starting to get into perimenopause. Now with perimenopause, we're starting to see estrogen do her little up and down thing. When estrogen, and if there's estrogen dominance, too much estrogen in ratio to progesterone, that excess estrogen is going to thicken the bile from that gallbladder. It's going to get sludgy. And so you eat some fat, that gallbladder sludgy. Now she has sudden pain, stabbing pain that shoots through. What does she do? She runs to the hospital. It's your gallbladder, we're just going to take it out. Like, wait a second, right? Let's preserve this gallbladder. And let's there's just managing with the GLP, managing a good healthy diet can prevent having any type of gallbladder attack. Now, women that are trying to do this GLP and they don't have a gallbladder, there's definitely, you can use bile salts to help support good, healthy bile movement. So we're absorbing and managing any fats we're taking in. So those are some of the concerns, at least that I see, with between the nausea and the gallbladder that we can easily alleviate through just really managing through those well. So, and that's what Chelsea and I will work on you with. Protein. So, how much protein? Well, it depends. Obviously, it's going to depend on what your ideal body weight is. But protein is important for your skin, for your muscle, for hairs, nails. And one of the things we see with the GLP is the loose skin, right? Everything starts to sag and you're just losing everything. You got the wings that my sister likes to make fun of me about. I still do my triceps, but it's still there. So we want to alleviate that. One of the best ways to alleviate that is truly by making sure you're getting enough protein in your diet. So ideal is going to be 0.8 grams per pound body weight. This is per kilogram. So the easy way to picture that is, for most of my women, I want them around 100 grams of protein a day. So the easy way to think is, this isn't quite enough. This is what 75 grams of protein would look like. It's not really quite enough for my women. They don't need this much. This is typically where my men need to be, is about 150 grams of protein. Women need to kind of be in between here. And if you're getting that protein, and with the GLP, the thing is, sometimes we'll talk about intermittent fasting and how in the world do you get that much protein in when you don't have much of an appetite in this little window, right? You really do. You have to eat in the morning, and you do need to be eating those 3 meals and kind of spreading that protein out through the day. That's really is important. So don't be skipping the meals. And make sure every meal has protein in it. I don't like to count these numbers. I use my hands. So for my women, 4 to 5 handfuls. If you get 3, that's really not quite enough for protein. You really want 4 or 5 handfuls. So think 2 eggs. Think a handful of nuts. Think a piece of meat the size and the thickness of the palm of your hand. And so if you can picture that, and most men need to be closer to probably 5 or 6 handfuls of protein a day, then we can really think about, now we're getting an adequate protein. And then you fill up your foods around that, right? Your vegetables and things, but really make sure your protein is center of your meals. And that helps you to be successful no matter what you're doing. This isn't just about GLPs. This is also about, how do we be healthy? I have a lot of menopausal women, very frustrated with their weight, not able to lose weight, not doing anything different than they did in their 30s and 40s, but boom, here I am, and 45, 50, 55, and I'm gaining weight, I can't lose the weight, I'm not doing anything really different. And what we're kind of seeing in the research is, hormones are changing, things are slowing down for women at this age, and on average, you've got to cut your calories by about 200 calories a day to be able to maintain your weight for women in that peri to postmenopausal. So you still need to stay active, but what we want is that quality, especially with protein, so that you're not losing your muscle mass. Because if you lose muscle, my ladies, if you lose muscle, you're losing bone. And we also don't, as we're aging, we also don't want to lose our bone. So I can't stress enough how important protein is. And that was really our focus back here on the foods, Chelsea's peanut butter protein bars, and then the salads and the meat. All of that is to say, you know what, it's really pretty easy to get that protein in. One of my favorite authors is Danielle Walker. I have one of her books back there. She wrote a book called Against All Grain. She healed herself from autoimmune, IBD, Crohn's, by just taking grains out of her diet. And so her focus is really on using whole foods, but her recipes aren't super complicated. So I love her stuff. So where, if you're interested, some of this we carry upstairs. I put my patients all on Full Script. Full Script's our distributor, so you can order anything out of the catalog. They do carry, I checked, and they do carry this. You cannot get this, or you should not be able to get this on Amazon. It's only through a doctor. They should be able to get that. But you can get it off of Full Script through a recommendation. So if that's something you're interested in. Everyone, if you're not on Full Script, you put your name on that sheet and your email, and I can get you set up. 15% discount's always there for anything within it. And it's nice because it ships right to you as you need. And as long as I think it's over $40, there's no shipping charge. So, and usually patients tell me they have it within 3 days. So it makes it nice because you're getting from, you don't have to worry about where you're getting your supplement from. And so,
and then I just have a handout on the table with a weight loss program. There's a 6 and a 12-week option, and just really focusing on support, checking in, making goals, make sure we're reaching goals. And if you sign up by Monday, you'll get 10% off.